know, it's such a great platform. Beautiful.
So we got Eshwin because I got to know about Eshwin through Mubina. Mubina ko to hum sab log jante hain. She comes here on a very regular basis. So she suggested that her friend does medicines review, and I myself was not aware of what it is and how it is to be done. So we thought that it will be a good information that we can get to our seniors to tell them what it is about and how do you go about doing it. And apparently it's a free service from Medicare. And Eshwin is a consulting pharmacist. So she's going to walk us through what needs to be done. Please, जो भी सवाल हैं आपके, keep it towards the end so that, and please make a note of all your questions so we can answer all the questions towards the end. And before we start, I would also request everybody to mute yourself. I'll be muting most people, but only when you have questions, unmute yourself.
Right at the end.
Yes. All right. Thank you. Over to you, Eshwin. Thank you for joining us.
Thank you, Veena. And thank you for inviting me as well. Yeah, it's always a pleasure, especially, you know, when I'm so passionate about medication reviews and when I get the opportunity to speak about it. Yes, of course, my presentation is mainly in English and I'd be speaking mainly in English, but I do understand Hindi. तो मैं हिंदी भी बोलती हूँ और मैं हिंदी में जवाब भी दे सकती हूँ. So, you know, if you need to ask me questions in Hindi, you know, you're most welcome. I think a little background would be useful. So I am a registered pharmacist and I've practiced in Australia for more than 20 years. And I have been accredited to do medication reviews since 2010. I became I specialize in aged care medication reviews and actually diabetes. So I have got a postgraduate certificate in diabetes management and diabetes education, which I did in 2015. So and since then, I mainly just review medications for people in nursing homes and in their homes. So, you know, wherever you are, I do that. Yes, so I'm going to do the whole presentation. I'm going to share my screen now, and then we'll talk more about home medication reviews. So let's do this. So I'm hoping that you can see the screen, Veena.
Yes.
Okay. Yep. So yeah, we'll just go on to the next page. Okay, so, you know, the introduction. So what we'll be talking about, we'll talk about what is the HMR program and who is eligible for HMR, who pays for the program, who does the HMR, and how do we benefit from the HMR. So what is HMR? HMR is the term that I'm going to use, the abbreviations, but that stands for the Home Medicines Review Program, which aims to increase quality use of medications and to reduce the adverse medicines events by conducting a comprehensive review of the patient's medicine in the patient's home. So, okay, some big words there. Where so increased quality use of medicine. What that actually would mean is, you know, that the doctor prescribes a medication. We will check that the medicine is right for the condition. It is prescribed at the right dose. So they're giving you, so you can see sometimes, you know, when they prescribe you a tablet, there is a strength there. So there's 10 milligram, that 5 milligram, 2.5 milligram, you know, so it has to be given at the right dose, right strength, right form. So, you know, medicines come in different forms. They can come as tablets, patches, liquids, injections. So we are able to, you know, sort of sometimes what happens is like some people can't swallow well. So it's no good giving them a big tablet and they can't swallow it. So, and the patient might not know that there is another form available where they might not need to swallow the tablet. It might be available as a patch, or it might be available in a liquid form. So these are the things that should be right, and the right frequency. So right frequency. So is this medicine taken once a day, twice a day, 3 times a day, or should it be taken before food, with food, or after food? These things. When we are there with you, we can educate you on that, and also check that you have been doing the right thing. So, and the other part of it is the adverse medicine event. So what does that mean? What that means is like every medication can have some adverse effects. And, sometimes we might be experiencing an adverse event or an adverse effect of a medication, but we don't know that is an adverse effect. So, this is more to educate the person what the adverse effect could be and to reduce the harm. So, if it's really making you very nauseous or very dizzy, maybe that is not the right medicine for you. Maybe there is something else that could be ordered for you. Also, we find when we do medication reviews is that we reduce hospitalization. So if the patient is taking the right medication in the right way, then obviously, they would not have complications and they would not end up in hospital. And the other way as well, like if the person is not taking the medication in the right way, a lot of the times you will end up in hospital. And also to reduce death. So, medicines or drugs are drugs. And, we can cause death if you're not taking it in the right way. So, that's why home medication review is so important. The other benefits of the home medicines review is to reduce the polypharmacy. So what is polypharmacy? Big word again. So polypharmacy is when somebody takes 5 or more than 5 medications. And this includes, medications prescribed by the doctor, medications that you might buy over the counter, like, Mylanta, creams, eye drops, nasal sprays, or the complementary medications. So these days, a lot of people will go and buy fish oil, krill oil, or, there's so many things out there that, what we call the complementary medications, the probiotics, the vitamin C's, vitamin E, and all of that, that's called the comprehensive. So all of this is included in the polypharmacy. And why we want to reduce the risk of polypharmacy is because when people take too many medications, then they will tend not to the adherence will be poor, where there's too many tablets to swallow. They might forget to take medications. They might not want to take all the tablets all the time, and this leads to other problems. It also increases the risk of harm or risk of adverse effects. And then again, lastly, it increases the cost. Like, the more tablets added to a person or, the person has to take, you're paying more as well. So, we do medication reviews to reduce the risk of polypharmacy. We do not want to see polypharmacy out there. Also to improve patients' awareness of their medications. So, why you're taking the medication, why it's so important to take it, in the right way, provide better understanding of patient medication and lifestyle issues. So, sometimes, yes, medications are there, but, we also will be able to, provide you with lifestyle issues as well. So an example of this will be people taking medications for high blood pressure. So, yes, medication will keep your blood pressure in check, and it is important because we want your blood pressure to be in check because we don't want you to have a heart attack or a stroke in future. But then, we also need to include some lifestyle things in there as well. Like we need to reduce the salt we take every day. We need to exercise. We need to see what we eat and drink and maintain that weight. So, so we will sort of be there to help you with the medication and maybe provide you with some better understanding of some lifestyle things that can be done as well. Also, I think the lifestyle is also sometimes, people could be on medications and, when we go to see them, these medications are packed in a bottle And, we find out that the person has arthritis and has so much difficulty opening that bottle to take the tablet out. So, we could recommend something, which comes in something else, which can make it easier. Also, the benefit is to assist to determine if the patient is seeing other professionals or acquiring medicines from other sources. So here what happens is, there's one patient, he goes to the regular GP and the GP prescribes. But then, you would be referred to another specialist and the specialist prescribes. Sometimes people see 3 or 4 specialists at one time. And not necessarily that everything has been communicated and everyone is aware who prescribed what and who's taking what, which normally is getting better with e-health now. But, sometimes it can be missed as well. And, acquiring medicines from other sources as well. So, some people might see a herbalist or a nutritionist or, somebody else who is also giving them some sort of medicine. So when we come to your home and we are looking at all the bottles of medicines you have, we are sort of able to pick, if there's duplication. So, there's things that you are taking, of the same medicine, or if there is, medicines that should not be taken together, because sometimes, 2 medicines taken together can cause harm. So, these are the things that, our pharmacist will be able to see when they come to do a home medicines review for you. Home medicines review also ensures patients' continuity of care. So, just to make sure that, the person is, if they were prescribed some medicine, for a chronic condition, that, to make sure that the person knows that this has to be taken regularly and, for a long time, will also ensure that, the medication is being monitored. So in the way of blood tests to see if the medicine is effective, or, X-ray, whatever you need to do to ascertain that a medication is working, or, blood tests to ascertain if it's causing any adverse effects. Okay, so the objectives of a HMR are, it is to achieve a safe, effective, appropriate use of medicines by recognizing and addressing the medicine-related issues that interfere with desired patient outcomes. So I think, while I was talking, you would have sort of got gauged, there's so many ways that, when we are looking at your medications, we can recognize these things. But then a good example is, when you are ordered a pain medicine, this is a very simple example. So, you're ordered a pain medicine for your knee pain. Well, it has relieved the pain, but you are so drowsy due to the adverse effect of that medicine that you've remained in bed. The outcome could have been to achieve pain relief without adverse effect of drowsiness, but the outcome is that you have the pain relief, but you've lost the quality of life. So, this is a very simple example that, this can be avoided. So, this is why medicines reviews are important. The other objective is to improve the patient's quality of life and health outcomes using best approach, and this involves collaboration with GPs, pharmacists, other health professionals, patients, and the carers. Okay, so we need to understand when we come to do a home medicines review, what happens? How does the process start? So the process is that your GP or your specialist had given us a referral. A referral is, where they've asked us to make an appointment, go and see the patient at their home and look at their medications. Once we've come to your home, we've looked at all your tablets, we've, determined what's going on. We have all your health conditions from your doctors, your medications, your blood tests from the doctors. We've put all that information together. We've prepared the report. And then what we'll do is we will discuss this report with your doctor. So we discuss this report with your doctor. The doctor might agree with some things. They might not agree with some things because they might have some more information there. And then the doctor will discuss the same report with you. And, together, we all work together, and then we make changes so that we can improve the quality of life for the the patient. And sometimes this can involve other health professionals as well, like dietitians, diabetes educators, physiotherapists. And sometimes the patient and whoever is looking after them, so their carers or their children, brothers or sisters, whoever is looking after them. Home medication reviews also to improve patients' knowledge and understanding of the current prescribed medications. So yes, there's a few venues where the doctor prescribing the medication might tell you a bit about the medications. Then you go into the pharmacy, and the pharmacist who will supply you with the medication might give you some information about the medication. And then, when a pharmacist or an accredited pharmacist comes to visit you in your home, can, answer all the other questions that might have been missed in between, or, if you have no information, they will give you the full information. So this is another thing. You have to, there's a difference between the pharmacist who works in the community pharmacy and who puts labels on your medications and gives it to you. A home medicines review pharmacist is different from that. They might be accredited who are supplying you the tablets, but this, I am not associated with any pharmacy. So I am a pharmacist who just completely does medication reviews. So, I'm not associated with any pharmacy as such, or any GP as such. Like, we work with the different GPs. So whoever is giving us the referral, we work with those GPs. But yeah, we're not associated with a pharmacy. Yeah, we are different. We need, the registered pharmacists are different from accredited pharmacists. Accredited pharmacists do extra qualifications to be able to do medication reviews. The other objective that we achieve is we facilitate a cooperative working relationship between the member of healthcare team in interest of patient well-being. So as I said, we work with other people, so the dietitians, the physiotherapists, or whoever we need to work with to bring in a good outcome for you. And yeah, medication information, we are the best source of medication information. Okay, so who is eligible for a HMR service? So HMR service is available to everybody in Australia who has been referred by their regular general practitioner or the specialist. It is also what circumstances can this referral be done? It is for anyone who has significant changes to a medication regimen. So there's a lot of changes have happened. You were on tablets, you've been changed to insulin or things like that. Whatever significant change to medication regimens, you are eligible. Anyone discharged from hospital after an unplanned admission. So no, you had a heart attack or something, you went into hospital, you are now coming home with heaps of tablets. Well, you are eligible to get a medication review done, because this will help you, sort out all that medication that you've come home with. If there is any change in medical condition or ability of the patient, so, including falls, so somebody who's having frequent falls can have a medication review done. Somebody whose cognition is declining, or whose physical function is declining. So people on high-risk medications, like these are some examples, but there is a lot more. But if you are taking warfarin, digoxin, methotrexate, phenytoin, these are very high-risk medications, which means, they can cause a lot of adverse effects. And it's important that you see a pharmacist. And I'm not saying that they're bad medications and they should not be taken. They're very good medications for what they're prescribed for, but they have to be taken in the right way. Also, people who have presentations of adverse effects. So, you have been prescribed a medicine, you come home, you've been taking them, you get rashes, or you're having frequent headaches, you've had tremors, anything can happen as an adverse effect. If you take a new medication and something new happens, it should be reported. And yeah, it makes you eligible for a home medication review as well. Patient not getting the intended response from the medicine. So, an example would be you're going to the doctor, your blood pressure is always high, they're giving you tablets, it's not working, the blood pressure is not coming down. They've changed it a few times, they've increased the doses a few times, but the intended response is not happening. your blood pressure is not coming to the, the number that the doctor is looking for, well, you are eligible for a home medication review because, we can check what might be the cause for that. Also, if you are non-compliant or, suspected non-compliant, a lot of people might not be non-compliant. Non-compliant means you're not taking your medications the way you should be. And yeah, sometimes it is, suspected, like the professionals would know if you are not taking the medications the way you should. So, you'd be eligible for a home medication review, or you have problems managing the medication at home. Sometimes, people would be prescribed different types of inhalers or insulin pens. They probably are not sure on how to use them properly. So, that would be one reason you'd be doing a home medication review. And the other one is the risk of inability to continue managing own medications due to changes in dexterity, confusion, or vision. So, we've spoken about that before. So, somebody with, who can't manage their own medications due to rheumatoid arthritis, for example, can't open the bottle or can't take tablets out of the blisters. Somebody who's having a lot of confusion, and confusion can be due to a lot of reasons, some medical conditions can cause confusion. And yeah, confusion can happen due to many reasons. Or if you have vision issues, your eyesight is deteriorating and you're not able to read labels or, differentiate boxes, then we can help you with a home medication review as well. Okay, so what happens with the cost of HMR? So as Veena has said, like right in the beginning, this does not cost the patient anything if you have a Medicare card. The accredited pharmacist who comes to visit you, they're reimbursed by the 6 CPA government program. So yeah, you don't need to pay us. We just, we come and see you at no cost. Okay, and that's, in the end, that's my detail. So, my mobile, my email, and you feel free to contact me if you need to know more about the process of HMR, or you need me to speak to one of your GPs for a HMR. Okay, I think I can stop sharing the screen now. Okay, so yeah, that is all from me, and I'm happy to answer your questions now.
Yes. Good morning.
Hello, Hemlata ji.
Yeah, good morning.
Good morning. How are you?
You're really good, very good information, but I have a couple of questions.
Yes, sure.
Like my husband is not well. He's taking more than 5 medication, like around 6 medication, but like then multiply the 7, like a vitamin, then 7, then vitamin D, then 8. So what my question is, as you said, like I have a letter from the GP too, but I don't know, my daughter, my son, somebody tell me like it's not good idea, mother. So I didn't done anything. So what I'm saying, like if I see like you or my pharmacist, do I get any problem with my GP?
So your question is, if you decide to see me, would that be a problem with your GP?
Yeah.
No, it wouldn't be. A lot of the GPs in Australia are aware of the home medicines review program, and it does not exist for the pharmacist only or the GP only. It actually exists for better quality use of medication for you. So yes, no, it should not be a problem with the GP, and the GP gets reimbursed from the government as well for referring you.
Because at the moment he's taking 7 medication, 5 is a medication, 6 is like a multivitamin, then vitamin D. So altogether like a 7 medication he's taking every day. So yeah, that's the reason I'm just a little bit worried about that.
No, it's good that you it's good to ask your doctor to give a referral to a home medicines review pharmacist. And at the moment in lockdown we can't come to your place, but once the lockdown is over, somebody can come to your home and have a look at your medications, and we can do the whole home medicines review process. And yeah, it shouldn't be a problem with the doctors. The doctors are very aware, and most of them are very happy to give the referral. as I said, the government reimburses them as well for the referral.
And one more question, like example, the medication, like original medication and the pharmacy's brand. Can you just explain that one? Like most of, like example, me, if I have to buy medication, then I will go little bit cheaper with the pharmacy's making one and not the original one. So both are the okay, or we have to worry about that?
See, most of the time, changing brands is not a problem. Some medications you cannot change brands, and we recommend you not to change brands. But yeah, most of the time, what you should know, you should know your medications by their generic name.
Yeah.
You should not know them by their brand names, because that is where the confusion is.
So whatever inside the things, that should be the same, correct?
Yes. And you should be consistent with your brand changes as well. It's not like 1 month you're taking, ACO brand, and then the other month you're taking some other brand. If you've chosen a brand, even if it's a generic, you should just be consistent with that.
That's the reason sometimes I tell pharmacy, if you don't have, don't worry, I will wait another 2 days, or I will go other place, but I want same brand. I do, because my husband is very sick, so I don't want to change the brand or anything. So that's a good idea, isn't that?
Being consistent with the brand is good, because it avoids confusion. Because this is where a lot of the time when I go to people's home to do home medication reviews, what I find is that they have 2 or 3 boxes of the same medicine, just different brands. So, that's a common confusion that happens. And again, it highlights the why home medicines review is important. And this is one thing we do. When we come in, we make sure that you're not taking, 3 different brands of the same medicine. Okay, so we've got Prem Lata, I think, who has a question now. So we'll go to, thank you. Prem Lata ji, your mic is off.
Auntie, unmute करिए अपने आप को पहले.
Oh, thank you. So sorry. So I want to know about my medicines, that I am taking my medicine regularly, whatever it is. Rheumatoid arthritis, I have rheumatoid arthritis, osteoarthritis. But can we change the supplements? Is it okay to change the supplements?
What supplements are we talking about?
Yes, like B12, calcium, magnesium, and vitamin D. So sometimes we go there and we do not get that, and we pharmacists say that you can have this. I take that. So is it okay to change the supplements?
Okay, so the question about the supplements is that, whatever you're taking, number one, if you're taking any sort of vitamin or supplements from the pharmacy, your GP should be aware what you are taking, what medication you are taking. And, if the other thing is when you get a medication review and I've come to see your medications, I can, sort of determine if these supplements are okay for your current medical conditions and your current medications. Because as I said, there are supplements. Some supplements can cause harm. So they can interact with your regular prescribed medications. They can cause adverse effects. So it's important that your GPs know. I think, Prem Lata ji, your question is that, if the pharmacist changes the brands of the supplements. Well, it all depends on, what you want to do. It's a choice there. That's why it's over the counter anyway.
Sometimes whatever we are regularly taking, that is not available there. The pharmacy says that you can take this one. This is also vitamin D, or this is also calcium. So I take the other brand. So is it harmful? Or,
yeah, you can trust the pharmacist for that, as long as you don't have 2 of the same supplements sitting at home and you don't know that they're the same medicine.
So can you suggest us some good brand names so that we can buy?
No, I don't do that. No, I cannot do that. I am not associated with any of the brands or any of the pharmacies. So my thing is you would have to go back to your pharmacy and go back to your doctor, to determine what you need to take. If you need my advice, then I need a referral to do a home medicines review, and I can come home and tell you if they're good or not.
Okay. Fine. Thank you very much.
No worries.
Okay. Very, very, very thanks.
We have any other questions?
Any Kapoor uncle, you have a question?
Yes, I have. First of all, I thank Neetu and others, and I deliver the lecture, whatever you say. Thankful. First time you introduce your qualification and everything background. I am so happy. Otherwise, some people come and start leaving the whatever they want. So then we keep very concerned. Your lecture, your system are up to date. We must go for in future for HMR. Even you go to my GP, he have no time. He recommend this and that. Explain us everything. Pharmacy is same brand, different, all and things. So I'm thankful to you. I have no question, but I am thankful to you.
Oh, thank you, G.
So
Thank you very much.
I understand each and every step how you handle it. That is good for us. For senior people must be take care and take your help.
Thank you. And I'm hoping to do more for the community. So I'm hoping that I can bring this in different languages as well. So
Okay, that is right. It is much better for everyone if you come with a different language. They will understand their own language. That is very good.
Yep. Thank you.
Thank you, uncle. Thank you for the feedback.
Kapoor uncle.
Anybody else has questions? सुदेश आंटी आपका सवाल है?
नो मेरे को बोलना है
आप बोलना चाहिए तो बोल सकती है.
आई ऑलवेज पॉजिटिव हैप्पी हो, किसी मेडिसिन की जरूरत ही नहीं है.
चलो टच वुड.
लाइफस्टाइल.
ये तो बहुत बढ़िया है. वो तो बहुत ही बढ़िया है.
किसी और को कोई सवाल पूछना है?
मैं तो सब
I believe. But you told that referral is a must. Doctor has to do
गुप्ता
that.
अंकल. सॉरी गुप्ता अंकल, आप क्या बोल रहे थे?
Referral is a must.
Yes, it's because we work together with the GP. So it's better that we have a referral, so the doctor knows that you're seeing somebody about your medications. So आपका referral होगा तो अच्छा होगा. It's it's just that then the doctor doesn't think that you're getting him checked or something like that. Then we work together.
But can we take your advice without his referral?
You can. The only thing is that then Medicare won't pay me, and it might have a cost.
Right.
Yeah.
Thank you.
No worries. And I think, Veena, I have a question for everyone. Has anyone had a home medicines review? Have you ever had a pharmacist come to your home?
I don't think so. The people were aware of that before. Because
Wow.
for me it was a new thing, so I'm not quite sure if anybody had it before.
Yeah, in fact, like I told you, I'm going to send your details across to my uncle because my husband's grandparents live there and they have a whole heap of medication. So I would really, send your details across to them because, they can make use of the service.
Yeah. I thought that there was a gap like this because, as I said, I have been doing the reviews for the last 10 years and I visit so many homes, but I never visit an Indian home.
And I think Ashwin, I think there is only the thing because many times people were not aware of these kind of services.
Now onwards,
So until they're not being told, until nobody's guiding them, like you can avail this such of services, or you just go for ask for a help. You can go ask for GP. Nobody knows. Until nobody knows, how will they ask for any help?
I was aware, but I didn't try because, as I said to you, like if I do this, can I have problem with GP? So that's the reason I was just stop myself.
So first thing is we have to go to the GP and request for referral. Then we can get only
your regular GP, yes. Whoever is your regular GP or your specialist. Even if you see a specialist, they can refer as well.
And Ashwin, only the some specific people can get the referral, or anybody, like if they have, as you said, the more than 2-3 medications, anyone can ask for it, or it has to be like some certified medications only if you're taking only, then you are eligible for that?
Anyone with a Medicare card.
Anyone with a Medicare card.
Yeah, if you want it at a free service, yes, anyone with a Medicare card can get a HMI referral.
Yeah, no, but my question was like, when you ask your GP, will it be some sort of like a thing like you are not on this kind of medication that you need to avail this service? This service should be availed by the people who having like as you said, like a higher dose of any high medications about like the Alzheimer things or heart attack things or diabetes things like that.
There might be, your GP might say that if they think that you are on simple set of medications, but it's really, if the GP is respecting the patient's patient's lifestyle and their choice that they want to see a pharmacist, that it shouldn't be an issue. But yes, you're right. Like some GP might say, oh, you're taking only one medication, you don't need to see a pharmacist. But it's very rare, like very rare that a GP would say that, because even sometimes I do medication reviews for kids with asthma. So, that they only have one condition and they might have only 2 inhalers. But it is so important that I go to their home and actually see what they're doing, or, make sure that they're using their inhalers properly. So, yeah, I mean, HMI has its, benefits, but, GPs can. They might not agree to it. I don't have a GP on here to say, there's another Zoom meeting that I once did, and there were some GPs, and they actually supported me, where they said, yeah, the GPs practicing in Australia, they're fully aware of home medicine reviews, and normally there is no issues. Normally you would be able to get a referral with no issues.
Fair enough. Thank you so much. Because I had a friend, like her husband's got a diabetes, and she was the one who was facing such a big trouble because the GP was not recommend them to go to a specialist, because he was keep saying that anyhow the specialist's gonna give you the same medicine which I am giving you, so why do you want to go there? So that kind of argument was happened, and then she was asking me if I can help her, like to find out somebody else like who's going through such a same thing, same issue. So if I can guide, but unfortunately I couldn't, because I didn't had anybody else who was going through the same situation.
I would say that, if the GPs don't refer, or they don't want you to be looked after by some, see, when a GP is looking after you and you are being referred to a specialist or being referred to anybody, it's just, a different set we are all humans. Doctors are humans too. There's just a different set of eyes, a different brain that will go through all of your things. There's no harm in that. So, there shouldn't be any issue when you're asking for a referral. If a GP is not referring you somewhere, there is some issues with the GP, I think. I mean, personally, I think, if you're doing your work right, you would not be worried whoever looks at your work.
Exactly.
Yeah.
Fair enough. Thank you so much, Ashwin.
Thank you, Ashwin ji.
Thank you so much. Thank you, Veena ji.
Thank you.
Namaste.
Namaste. Happy Shri Krishna Janmashtami to everybody.
Oh, thank you.
Happy
Thank you so much. Such a sweet gesture.
You as well.